Welcome to the IpX True North Podcast, where we connect people, processes, and tools. This is episode 11. Today we have President of IpX, Joseph Anderson, and Eric Pettis, the Director of QA and RA for Bose Health. They'll be discussing redefining innovation and quality, the bridge from consumer goods to medical devices.
Eric, just want to take a quick opportunity to say thank you. Been looking forward to this. I want to thank you personally for taking the time to join. I know what you've been tasked with at Bose. I know your schedule's a bit busy, and I also want to thank Bose for allowing you to join us on this True North podcast. So thank you. Thank you very much for joining us.
It's my pleasure, Joe. As you know, from the time that we spent together over the past couple of years, we think alike and we have a commonality, a mission. So anytime I can help you and IpX sharing what little we've been able to do here at Bose, it's my pleasure.
Fantastic. I'm looking forward to this discussion. As you mentioned, you and I have now known each other for a couple of years, not going on 3. Time has flown. IpX has been working with Bose for honestly over a decade now, and it's been a great relationship. But I'm really excited today to get to learn a little bit and to discuss and for our audience to hear what's going on at Bose, because there's some exciting things that we've known about from the IpX side that we weren't at liberty to talk about, and really looking forward to talking to you today about the Enterprisewide Quality Initiative at Bose and what that means in regards to some new product announcements that some of our audience members might have seen over the last couple of months. So with that, Eric, I'm going to kind of throw it at you, and you and I will kind of go back and forth, but why don't you give us a little insight into this enterprise-wide quality initiative at Bose?
Sure. Yeah, so I have 2 anniversaries that I celebrate 2 days apart every year. July 23rd was my first day at Bose, and July 25th, yesterday, was my 41st wedding anniversary. So they're tied together, and it's interesting that there's a lot of commonality between being able to be married for 41 years and be happy, and driving an enterprise-wide quality initiative at a company like Bose. You have to constantly be a great listener, and you have to be able to kind of go with the flow. So Bose is a unique company, as any company is that has a founder. Dr. Bose, obviously the founder. And there's a very strong culture within Bose where the feeling was that quality was integrated within the roles of everybody in engineering. And so it's a bit unlike other companies in that it doesn't have the traditional, vice president of quality role that reports into the president and is on the senior leadership team. We do have a VP of manufacturing the global supply chain, Michael Edmonds, that I report into, and he's kind of the de facto quality leader at the exec level. But on the commercial side of the business, if you look in the rearview mirror, the feeling was that quality was really integrated as a part of everybody's job. And then along came our automotive division, and our automotive division entered the realm of IATF 16949 quality system registration, the formality around a quality management system. And they found that in order to be successful, they actually needed to ring fence that division and implement a formal quality management system. And that happened, maybe 8 to 10 years ago, and highly successful. We've won the GM Supplier of the Year award, I think 8 out of 9 times over the last 9 to 10 years. And so, it's proven the value of what a formal quality management system can do. And then most recently, July 23rd, 2018, they hired me to come in and implement a formal quality management system to launch first a Class 1 and then a Class 2 medical device. So again, it's a brand new division, the health division, and we're leveraging a lot of corporate activities that really live in that realm of no formal quality management system. So much like a marriage where you're married for 41 years, if you're going to be happy and successful, it takes a lot of change management, a lot of listening, a lot of education, a lot of training, and a lot of adaptation and adjustment. And the journey to get us to where we are today was fast and furious. They gave me 90 days to implement a quality management system to meet the requirements of 21 CFR 820 and FDA to launch our first class one, which we were successful in doing. I've done that 10 or 12 other times in 9 to 12 months, but I've never done anything really good in 90 days. So that led us to launch most recently our first class 2 medical device, and that's the Bose sound control hearing aids, which is the world's first direct-to-consumer hearing aid that doesn't require you to go see an audiologist, and you can actually buy it over the counter. So with that launch, and working with Michael, my boss, we're marching towards a longer-term vision of incorporating a more formal approach to quality management systems for the rest of the business. So, automotive check, health check. We're currently going through an ISO 9001 2015 certification process for our aviation, military, and broadcast business, check. By November, we'll complete our ISO 1345 2016 certification process as well, another check. But the great unknown, and the undiscovered country, the work of the evangelist and the missionary is really to bring a more formal approach around quality management systems to our largest division that in the rearview mirror hasn't really seen the need or really understood what a formal quality management system at the enterprise level can do. And so that's the current challenge, Joe. And like a marriage, if I try to get that done in 9 months, I'll fail. A year and a half, I'll fail. 2 years, I'll probably fail. But if I look at, 2 to 5, and because it's going to take a lot of change management, I think we can get there. And as you well know, because I'm preaching to the choir, a process-based approach to running a business, if you don't have that, you really don't have anything.
Absolutely. And I think where I'm going to go here in a minute, and you'll probably smile, but just for our audience's sake, and this is something I've preached about multiple times at various summits. A lot of people get that quality management system confused with a quality management IT solution or tool. And that's not what we're talking about. And I don't think that's what you're talking about at Bose. You and I have discussed, with IpX and our relationship with Bose, CM2 is a quality management platform. And that's all the processes, that's all the OCM needs that your organization is going to need to actually have a platform from a process perspective, from a roles and responsibilities, and your supporting IT tools. So I think I just want to clarify one point. From when you say quality management system, you're looking at that whole ecosystem, that entire platform at Bose, and kind of an evolutionary step change for the next generation of Bose products.
Absolutely. And you hit on a very important point. The quality management system technology is a container or a tool that enables. So we happen to go with PTC Windchill solution because we're a Windchill house. And we implemented the medical versions of their, CM2 or document control. It's not CM2 compliant, but their document control engine, because it made good sense from a business perspective because we were already a Windchill house. And we've been able to gain some important efficiencies through their automated training portion of their document control, where the the whole training matrix and the sending of automated emails and electronic signature compliant to 21 CFR Part 11, blah, blah, blah. It's all there. And, it probably saves us one or maybe two full-time equivalents from an efficiency perspective. And it's a great tool. But if the documentation that people are getting trained on is garbage, then it really doesn't matter. So the tools are important to the extent that they're an enabler. But what we're really talking about is a process-based approach to running a business end-to-end with inputs, work, outputs, where the roles and the responsibilities of everybody is clearly defined, and where we figure out how to do the work that we do at Bose the most efficient and the most effective way we can at the lowest total possible cost to drive the maximum amount of customer satisfaction and return for the business and the business stakeholders. Because at the end of the day, we're not running a charity. We're here to make a reasonable profit. But what's most important is astonishing and wowing our customers, because without that, we've got nothing. And really does take a process-based approach. And the company has moved in that direction with the launch of our 1NPDP product development process, where we standardized product development across 4 divisions. So now the divisions, it's no longer anarchy, a division, doing whatever they see as right in their own mind, which is the definition of anarchy. But it's getting an appropriate level of standardization across the divisions around common activities and doing them in the most efficient and effective way to get the desired outcome and results. So there's no doubt that Bose is committed to a process-based approach to quality. It's more, it's more important, like in a 41-year marriage. I know the words that I can say that can blow it up, and I know how to make it a wonderful day. And so it's really all about how you approach people and how you convey what you want to do in terms that they can best understand and accept. And that's the trick,
Absolutely. And, for me and, us at IPX, you've touched on kind of the quality management platform DNA, the CM2 DNA, where we talk about communication, we talk about cost, and we talk about compliancy, and that drives competitiveness, and what you're really talking about, is the future sustainability and scalability at Bose. But before we get into some more challenges, if you quickly could just give us a layman's definition of what a class 1 and class 2 are for the audience members that might not understand the complexity of what Bose really had to go through to get into this new market.
Yeah, that's a great question. So FDA defines medical devices in 3 classifications, class 1, class 2, and class 3. You can think about your class 1 products as toothbrushes, Band-Aids, very low risk. It's a risk-based classification system. So our first class 1 product that we launched were Bose frames, and they are sunglasses with a soundtrack. So you put the sunglasses on, and they play music, they stream, they take telephone calls. It's an amazing product, kind of first of its kind at this scale, but they are design control exempt. And so the requirements are not as stringent as a class 2, which would be like surgical devices, hearing aids, wound care. And then class 3, it's another ratchet up in risk to pacemakers, implantables, artificial knees and hips. So, class 1, low risk, class 3, highest risk, class 2, medium risk, kind of like, mama bear, papa bear, and baby bear. In the hearing aid space, traditional hearing aids that require you to see an audiologist are also exempt from a regulatory filing. So for a normal class 2 medical device, you would have to submit a de novo regulatory filing if it was a brand new technology that no one has ever done before. And Bose submitted our de novo back in 2017 for the world's first direct-to-consumer hearing aid not requiring an audiologist. And we received clearance on that submission. And then the FDA said that if you're going to be a direct-to-consumer over-the-counter hearing aid, you're going to need to do a submission. So normal hearing aids are exempt from submissions, but because the direct-to-consumer doesn't require an audiologist, it does require a submission. And so when we launched our sound control, that was what's called a 510K submission, where we had to prove substantial equivalency to the predicate device, which was the de novo clearance that we received back in 2017. So that kind of threw a big monkey wrench into the hearing aid industry, because by and large, they never had to do a regulatory filing or submittal, but now to be OTC or DTC, that will be required. And then a class one, because of the risk is so low, they're called design control exempt. So the requirements for design controls don't apply. And then regardless of whether it's a class one, a class two, or a class three, you have to have a quality management system, which is the content, not the tool, that meets federal regulations. So there's a regulation called 21 CFR 820, and that identifies all of the requirements for a quality management system, from design and development through to post-market surveillance. And maybe an equivalent to that would be ISO 1345 on the medical side, or to some listeners that aren't familiar with medical, it could be IATF 16949 for automotive, or ISO 9001 for commercial. Those are all requirements documents that are about 80% identical, directionally correct, that identify all of the requirements that you have to meet. And it's no small task to create a quality management system, a hierarchical set of a quality manual, probably around 30 to 40 procedures, maybe 70 to 80 work instructions, and maybe 100 forms. And then you have to train everybody to follow these systems. You have to generate objective evidence that proves that you actually followed your process with forms correctly completed, attested to with signatures. It provides the objective evidence that you meet the requirement. And then on top of that, FDA will come in and do periodic inspections, which no one really wants because they can be painful. And if they identify problems, you can be subject to voluntary or involuntary enforcement actions, up to prosecution. The investigators, carry badges. Sometimes they can carry sidearms. They're federal officers, so it ups the game. And so, the key is really wanting to keep your product on market. And if you do a bad job, you're going to be pulling your product off the market, and you won't be able to sell it by law. So it's kind of working to a higher standard.
Yeah, absolutely. And this topic is, not only exciting me professionally, but also personally. When you touched on, CFR 820 and all the other industry specific regulatory requirements and standards, that's from a CM2 perspective, our -500, which is the industry standard for meeting compliancy regardless of the market you're in. But also my 12-year-old son has hearing aids. And I want to touch on one thing, the complexity that you're talking about and that submission, getting that approval. My son today for his hearing aids has to go to an audiologist and do a hearing test, and then they program his hearing aids. And you do that about every 6 months or to a year, depending on your need. Bose is really changing the game here. And my son's excited as Bose expands into eventually all of the states, and maybe you could touch on that and the complexities and challenges there. But what this means is it gives a lot of empowerment to the individual that needs these hearing aids, and it makes it a little bit if not a lot more efficient and effective for them to be able to program their needs based off of venue or environmental setting straight from their phone. And one thing that my 12-year-old son is most excited about is the Bluetooth ability as well. But if you could expand upon, kind of where you're at on the rollout of those, the challenges of meeting regulatory state requirements, and some further challenges of this new Bose quality management initiative.
Sure. Yeah, I'd love to. Yeah. So President Trump passed into law the Over-the-Counter Hearing Act legislation, but FDA now needs to publish the rules that actually implement that act. We've been waiting for the rules to be published for quite some time. President Biden recently issued a request to FDA in a larger document around recreating or enhancing the competitive nature of the U.S. economy, a request that the FDA publish these rules within 120 days. The rules were already supposed to be published. Once the rules are published, there's a review period for industry to review them and provide feedback, and then the rules are then published and go into practice, into law. That's usually a 6-month time period. So if we're looking at the rules being published in 120 days, that's 4 months, and then another 6 months puts us at 10 months from now, which would be the earliest that the rules would actually be published. And then by being published at the federal level, they preempt state law. Right now, the rules aren't published, so theoretically, we have to follow state law. So if you look at state law across the 50 states of the United States, each state has their own laws and requirements around hearing aids. There are five states that we initially launched in that we felt were it was legal to do so at the state level, or we felt that the risk of doing it prior to the rules being published was acceptable. And as a company, I can't speak to what our future plans are going to be, but just stay tuned is all I can really say, because I'm not at liberty to talk about any future changes to that. But I think people will be happy. As far as the freedom that it gives our patients and our customers to be able to adjust the sound on their own, it has been clinically proven that the Bose Hear app, in combination with our sound control hearing aid, is equal to or better than the quality of an audiologist tuned hearing aid. So that's been clinically proven, and that was clinically proven in our de novo and also in our 510K for sound control to prove substantial equivalency. So it does provide a lot of freedom to hearing aid users to be able to adjust their volume at will with the Hear app. And I think that's what makes people most excited about the product. I mean, there's also stigma. And as you know, hearing aid is a big stigma driver. People don't, want to admit that they're getting older, right? Like we are, Joe. They don't want to be seen wearing a hearing aid. It can be extremely difficult for them to even go in and get a hearing test, let alone the scheduling of the appointments with audiologists. But right now, people that maybe in their heart of hearts really know that they've got a problem, they can buy the hearing aid direct to consumer, currently in the 5 states, and it's like nobody knows, right? So they get around that whole stigma, and they can do it on their own. It provides a lot of flexibility and freedom, and that was really our hope as a company, was to make good hearing available at a reasonable cost, And I think our sound control is marketing in the $800 range. Um, and hearing aids can go up to $7,000 to $8,000 to $9,000 for a pair. So the affordability, the availability, the being sensitive to stigma, and the providing the customer or the patient the ability to self-control what they need depending upon what environment they're in. It's really huge.
Yeah, absolutely. I'm a big fan of making these more user-friendly applications from a cost perspective and functionality. And when you touched on the cost, that's a huge differentiator. The affordability also is something that drives people away from actually being able to properly hear and enjoy those things. I know when my son first got his, he went outside with them, and he's hearing the sounds of nature, and he's kind of blown away. And it's things that we take for advantage, right? We don't always appreciate the things that we should. And I'm hoping this opens the door for those people that can't afford or don't have the insurance to cover that $5,000 to $9,000 hearing aid fee. And that doesn't cover the audiologist and the doctor exam. So this is quite remarkable, and I'm excited for Bose. Are there any more challenges that you want to discuss before we get into the solution? Because this is where, I really think Bose shined as an organization. And I know you are were personally vested and are still vested and proud of what you've achieved. But, are there any other challenges? And the only one that I could think of, that a lot of people forget when you're talking about a quality management platform or initiative, you're really talking about full traceability, right? From a product, from a network, supply chain, compliancy. Are there anything from a challenge perspective that you want to discuss related to traceability or anything we haven't covered before we move into the solution?
Sure. Yeah, it's a great question. So, Bose does something unique. Before the unique device identifier FDA rule was published, it requires every class 1, 2, and 3 medical device to have what we call a UDI, or a unique identifier that meets certain requirements. I won't get into it because it's kind of boring. But Bose has been putting a unique serial number on all of our products forever. So, rather than the traditional lot control concept, where you have a manufacturing lot that's homogeneous, that if there's something wrong in that lot, it's probably wrong in all of the lot because it's a unique manufacturing run, right? So Bose didn't really do lot control because they have a smart serial number on every single product. So it's like overkill. And that's kind of Bose. Bose kind of in certain areas kind of blows me away because they go much further than any other company that I've ever worked for to do certain things like a unique serial number. So, we implemented lot control predominantly to protect us from recall, because if you don't have lot control, then you have a problem, with a product in the field. And without lot control, everything you made is one big lot. And so we needed to drive some of the medical requirements that address more risk control, not necessarily risk. Well, it is risk control around the patient, because if we have a defect in a lot, we want to be able to recall that lot to protect the patients. But we also want to recall only what's bad and not everything to protect the shareholders. So there were numerous instances where, we were doing too much, and if it's understandable, but in a 90-day period, in order to hit the mark, we had to do only what was required, because I had 15 work streams and a team of about 70 and 400 action items that all needed to be driven to ground and implemented within a 90-day period. People are probably going to call me a liar, because even I find it hard to believe that we were actually able to do it. And like putting it on my resume, it feels like nobody's going to believe me that we actually did it. They're just going to, think I'm embellishing.
Not an easy challenge, my friend. Not an easy challenge. No, I think it's amazing. We've, as a child, Bose was just that name that was just associated with quality and speakers, and so watch as an adult, and as you so gracefully mentioned, as I've aged and aged rapidly over the past few decades, watching Bose kind of evolve. Based off of industry need, and to see where you're going with the medical device and where you could go with medical devices is pretty exciting. And with that, let's kind of dive into the solution. I think we all understand getting in the medical device world is not something you just walk into, and it's a level of complexity, and it brings a level of challenges that most, quite honestly, I don't have the stomach to endure. But let's talk about some of the fun, the solution, and then we'll get into the result. And let's talk about that overall solution. What was the magic?
What was the magic? In the Bible, because I'm a historian, and it's a great history book. It's a great religious book. And I'm not getting into religion. But Moses found that when he was trying to judge the people, he sat before the people day and night, and had to listen to case after case after case and tell people what they needed to do. And I kind of like it. I mean, I am no Moses. Don't get me wrong. I'm a flawed man. That's why I've been married successfully for 41 years, Joe, because that's my approach with my partner. So. But initially, we had entertained a consultant who came in for a 4 to 6 week engagement that left us with 600 action items. And I had the choice of spending millions of dollars rehiring them to help us to do the implementation, or go it alone. And I chose to go it alone because it's not that I didn't believe in the consultant, but I just didn't think that we could get there fast enough with them. And so with a team of one, and nobody in the company that knew med device other than a consultant that we had hired about a year and a half, 2 before they brought me on board, I was like the Moses. So it was a Herculean effort of going through the 600 action items and then saying, okay, much like with Bose wanting to drag me down the street with a rope, I had to right size the list and take risk. And so, you're not going to take risks that sink a boat, but you may take some shots and you may take on some water, but you've got to be able to accomplish your mission. And accomplishing your mission doesn't mean being perfect. It means being good enough. And good enough is not in the Bose vocabulary. So, transitioning that good enough approach and trying to hold people back and only do what was really required was tricky. And I worked 12, 15 hours a day meeting with the 15 workstream team leads and reviewing their individual action items and teaching them what it meant to solve this action. What does it really mean to, and I could just, there's just so much. Because if you look at the 820 standard, you'll see that it's got a lot of content. And with nobody here really having any medical experience, and the majority of the company being in the commercial realm, not having a formal quality management system, sometimes they were looking at me like I had 3 heads. And so it just took an amazing amount of individual coaching. And then the other so yeah, that's me. Okay, big deal. I mean, I'm not the hero, but I was all I had. And then I reached out to 2 people that I had worked with previously. One was a regulatory guy, and another was a quality systems guy. And I brought them on board. And I brought a another consultant on board that I had experience with, and then we split the work up in terms of managing the 15 workstream team leads. So that's what Moses did, right? Moses was exhausted, and so then he created a tight-knit team of close advisors that he could trust, and split the work up of judging the people, and it became more tolerable. And so that was the next thing that we did. Of course, we had to use paper-based systems. So it's a good thing that I'm, on the, I grew up on that stuff, because I'm older, right? It used to be that, we didn't have cell phones, and we had typewriters with 3 carbon copies. And people are going to listen to me say this stuff, and they're going to be like, wow, I can't imagine what that must have been like. But I grew up in the day putting in regulated quality management systems for nuclear submarines, nuclear power plants, wire and cable plants that made safety-related cable. I've got a 42-year career. I've been doing this my whole life. And so we had to start with paper. So it was fine. I knew how to do it. And we concurrently validated SAP and Windchill and 4 other smaller software applications that supported design and development, so that we could then convert, from paper to, an automated process. And we were able to do that. People aren't going to believe me, but we validated SAP and Windchill in about 16 weeks. And that just doesn't happen. And then the last element, it was change management. And so we identified all the people that did the work from a role and responsibility perspective. We traced them up through the organization, which wasn't easy, believe you me, right up to the senior exec team. And then we kind of potted them into verticals. And then I created a change management presentation. It's a 90-minute session, about 45 minutes, 40 minutes of presentation, about maybe 15 or 20 minutes of individual work, and then the rest of the time was spent receiving the feedback from the people that we were trying to change, and that was highly successful. We videotaped a lot of it. The last element was the senior leadership team at the time were all over this. I went into them 3 weeks in and said to them what no one has ever said to the exec team at Bose: we can't do this in time. And so the decision was, if we launch Bose frames on Bose.com and we forego working with our reseller partners, if we can't do it, we only disappoint ourselves. Would you still try to do it, Eric? And if you can't do it, we'll pull the stick up and we'll abort. So I love a good challenge, and so I said, let's get her done. And I met weekly with the senior exec team with a report out, detailed KPIs, red, yellow, green, report cards, and there was nothing that they wouldn't do to support me. And everybody in the company knew that I had their support. I did 3 to 4 company-wide videos that were published on our Yammer site that went out to the whole company, just talking about the initiative. It was really well done. So that management commitment, when you ask quality professionals, what's the single biggest problem they have experienced in their career in trying to drive quality forward? And unequivocally, it's a lack of management commitment. So having management's commitment, and not just the blah, 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 but demonstrable, visible, vocal commitment. And it was just amazing.
Bose was still designing new innovative product for their other markets, right? They're still supporting their current customer base, and looking at other ways of improving the supply chain. So, and Eric, this is where you can kind of correct me if I'm wrong, but I want to get a quick little proud statement in here. In addition to everything you were doing, Bose was moving in parallel with you with other initiatives, right? From an organizational perspective, we were IPX was working with Bose and CM2 training, conducting CM2 training with the workforce, and that's about product and quality lifecycle management and understanding the true digital thread and digital twin. I'm not going to get into that too much, but the one area that you talked on, which was from a system, a tool, IT tool perspective, you've got some great stakeholders there, that, and when, Chrissy and Jane and Brian and all these individuals that we've been able to work with from a process and IT perspective, when you look at what you're able to do from a PLM system and a true QMS tool, utilizing, some of the CM2-500 as almost your functional requirement spec, there were a lot of initiatives going on in parallel to this initiative. And I think that's something the audience needs to understand. Bose didn't just shut down and focus on this. There's a lot of integration across multiple markets and multiple competencies, and some org changes as well to really define, this next evolution of Bose. So there's a lot going on from a solution perspective, and hats off to Bose, because I can't describe it all. It's outside of my confidentiality, but what I can say is Bose really went after, and I believe is still going after, defining and deploying this next Bose. What is the evolution of Bose? So there, when you get into this solution of what you were able to accomplish on this med device side, coupled with, I know you had to deal with this, all the other initiatives, that's fairly impressive from a solutions perspective.
Yeah. And the last 3 years has been nothing but transformational for all of Bose. I can't obviously get into the details from a confidentiality perspective. But when COVID hit, it's no secret that every company on the planet, except those maybe making masks or, that needed to provide a solution for the pandemic, took a big hit. And we weren't immune to that. And it really, that coupled with maybe a look in the rearview mirror around, the past 2 or 3 years of our product launches, it was kind of a moment for Bose to take a step back and determine, what do we really want to be moving forward. It's no secret that we had change in leadership. Phil left the company, and we brought in Lila, our new CEO, and such a breath of fresh air. It's almost as if someone cloned Dr. Bose with Lila, and she isn't changing Bose to be different than what the founder created here, but it's a integration of all the great aspects and dreams and aspirations of what Dr. Bose caused all of us here at Bose to believe in, right? The belief in human potential, to try to help everybody achieve their highest human potential. And I lived that. I mean, I've been living that since 2004 from a personal perspective. And, my mission in life is to evolve as a human being, to be the best that I can be. And it's not about making money. It's not about career aspiration. It's about humanity. And she's come in and taken that spirit of the founder around that and integrated it with maybe a more refreshed and modern approach to running the business, to bring us where we need to be to continue to astonish and wow our customers. And, I did it last year and I did it again this year. I posted on our all company Yammer site on my anniversary. And I'm a mentor for our internal mentorship program. And Raj, my mentee, and I happened to meet the day before my 3rd anniversary. And, we talked about, what makes Bose special. And I really started to think about it. And all I could come up with was I was sitting in my office at home, and I had this hodgepodge collection of Bose product on my tabletop. And I'm looking at it, and I realized, number one, I'm a Bose junkie. I mean, I've got so much Bose product, and every single one of them, when I turn it on, like the other day I was out, we're blessed to have a pool out back, so I was out there and I turned on and this isn't a commercial, it's just coming from my heart, our Bose 300 home speaker. Every time I open that up and I play music, I just like astonished at how good the sound is. Or my the first time I put on a modern pair of QC35s, because mine were like 18 years old and all beat up from traveling the world, and I said to myself, these are life changing. And so that's what makes Bose special. And how do you preserve that and create an end-to-end process approach to running the business that achieves that? So it's the combination of technical skill and process-based approach and tools and all of that good stuff that we believe in. But what we're really trying to achieve is a human emotion of astonishment when people turn our products on. So it's that integration of those two worlds. And she's doing a great job.
Yeah, and I think that's the result of everyone at Bose, constantly trying to achieve that vision, and that kind of brings us into the wrap up. And I'm much like you, Eric, and this. I'm kind of a Bose junkie myself. I don't unfortunately get to use anything that I purchase. It ends up typically going to my kids. I spent time designing these over the ear headphones. Every single element on the Bose site, it's copper and black contrasting. Was real proud of them, and my son now uses them. I think I got to use them once on an airplane, but I'm excited to be a part of this Bose journey. And again, as wrapping this up, with what you just stated, and kind of this vision to take Dr. Bose's dream and couple that with modern technology, modern processes, where we're headed from a global perspective, from a humanity perspective. What do you see the result being now? And if you had a magic ball, what's the result going to be in the future? If you could predict, from a Bose perspective, what's that look like?
That's a great question. And great questions aren't easily answered sometimes, that they're really, really good. And that's a really, really good one. I believe that Bose is like an organism. Okay, it's made up of thousands of employees with varied roles, varied reporting relationships. But I see us as a company moving towards being one in terms of a shared vision. Right? Without a vision, the people perish. Right? So there's definitely a reemphasis on a shared vision or on a future definition of what we want Bose to be. And the people that are here are all, for the first time, formally linking, all of our individual goals and objectives right to the top of the vision that Lila and the exec team have put in play this past year. So a lot of thought and a lot of work went into ensuring we had the right vision of what we want to be, and that's a company that continues to put products out on the marketplace that people can't live without, that they absolutely love, that they're astonished every time they turn them on, and it creates that human emotion of like, wow. Okay, but to tie the whole organization together from a goal and objective perspective to achieve that end is a big job, and it's been done throughout the hierarchical structure of all that we are. We are all clearly tied into that high-level shared vision, and everything that we're doing is to achieve it, even if it's tactical. And during my change management processes, I said, look, we win or we lose as a team. The New England Patriots weren't great, and I use the weren't in the past tense, right? But they weren't great because of Bill Belichick and Tom Brady alone. But the water boy, the janitors, everybody that had a role in the organization was a team, and they wouldn't have accomplished everything that they did without a team effort. And greatness results in the alignment of the team to a shared vision that everybody can believe, that every day when they come into work, they know that what they're doing is achieving that shared vision, and that they're not coming in to make parts, but they're coming in to make a difference, that emotional connection. So, that sounds all wonderful and everything. You don't do that in 6 months. You don't do that in 9 months. It's a longer term play to drive the organization to have that oneness of purpose. And gosh, I can't even imagine that if we're successful, what will result from that. I think it's going to be astonishing. I don't have words for it.
Well, I look forward to it, Eric. And, with that, I think that's a great opportunity for us to wrap up. I just want to say thank you for your time. I want to say thank you to Bose for this opportunity. And for me, again, this is personal and professional. And I think you touched on that through this entire podcast. And I think that we need to get back to, and if anyone's heard me speak before, those times in a product's lives when it was more than just getting a new thing to a consumer. It was about the overall experience. It was about loyalty to your consumers. It was about guaranteed quality, guaranteed function, guaranteed performance. And I'm really excited for Bose. I'm excited to sit back as a fan of Bose products and innovation and see what's to come. Professionally, from an IpX perspective, all I can say, it's an honor to have been a part of the Bose team and various initiatives. And we look forward to continuing that partnership and to be part of the Bose journey. And Eric, just again, thank you very much for taking the time today.
Thanks so much, Joe.
Thank you for tuning in today. Don't forget to subscribe and review the show. And for more information on IpX, visit ipxhq.com.